used. In urinary catheterization, a latex, polyurethane, or silicone tube known as a urinary catheter is inserted into the bladder through the urethra. Catheterization allows urine to drain from the bladder for collection. It may also be used to inject liquids used for treatment or diagnosis of bladder conditions. A clinician, often a nurse, usually performs the procedure, but self-catheterization is also possible. A catheter may be in place for long periods of time, also known as an indwelling catheter, or removed after each use, called intermittent catheterization. Urinary catheters come in many sizes and types. They can be made of rubber, plastic or PVC, and silicone. So next I've written up the types. So there are three main types of catheters: indwelling catheters, external catheters, and short-term catheters. In the case of indwelling catheters, you get two types: urethral or suprapubic catheters. I've added two pictures here of a Foley catheter and a suprapubic catheter. An indwelling catheter is a catheter that resides in the bladder. It may also be known as a Foley catheter. This type can be used for short and long periods of time. A nurse usually inserts an indwelling catheter into the bladder through the urethra. Sometimes a healthcare provider will insert the catheter into the bladder through a tiny hole in the abdomen. This type of indwelling catheter is known as a suprapubic catheter. A tiny balloon at the end of the catheter is inflated with water to prevent the tube from sliding out of the body. The balloon can then deflate when the catheter needs to be removed. Next, we have external catheters, and a great example of them are condom catheters. A condom catheter is a catheter placed outside the body. It's typically necessary for men who don't have urinary retention problems but have serious functional or mental disabilities such as dementia. A device that looks like a condom covers the penis head. A tube leads from the condom device to a drainage bag. So over here, I've added two pictures. On top, the first picture is just a picture of a condom catheter, and down I have included a picture of how it should look like on a patient. These catheters are generally more comfortable and carry a lower risk of infection than indwelling catheters. Condom catheters usually need to be changed daily, but some brands are designed for longer use. These can cause less skin irritation than condom catheters that require daily removal and reapplication. Short-term catheters or intermittent catheters. Right here I've included a picture of what they look like. A person may only need a catheter for a short period of time after surgery until the bladder empties. After the bladder empties, it's necessary to remove the short-term catheter. Healthcare providers refer to this as an in and out catheter. In a home setting, people are trained to apply the catheter themselves or with the help of a caregiver. It can be done through the urethra or through a hole created in the lower abdomen for catheterization. Right here, I've included some pictures of all of many different types of catheters: straight, suprapubic, indwelling, and condom. Next, I will be talking about the indications of different types of catheters. In the case of intermittent catheterization, it is indicated for the collection of sterile urine sample, provide relief of discomfort from bladder distension, decompression of the bladder, measure residual urine, management of patients with spinal cord injury, neuromuscular degeneration, or incompetent bladders. Next, we have short-term indwelling catheterization, which is used post-surgery and in critically ill patients to monitor urinary output, prevention of urethral obstruction from blood clots with continuous or intermittent bladder irrigations, instillation of medication into the bladder, surgical procedures involving pelvic or abdominal surgery repair of the bladder, urethra, and surrounding structures. Urinary obstruction, example, an enlarged prostate, acute urinary retention. In the case of long-term indwelling catheterization, it is used in refractory bladder outlet obstruction and neurogenic bladder with urinary retention. Prolonged and chronic urinary retention. It is also used to promote healing of perineal ulcers where urine may cause further skin breakdown. Lastly, we have external catheterization, such as condom catheters, which are used in urinary incontinence, mainly in men, overactive bladders, and diseases such as dementia, and in mobility issues. That would be all. Thank you.